Dr. Laird, I wanted to get your opinion on, so a lot of times we have clients that, it's the physicalness of, like you said, getting out of bed and getting to the toilet in time. And of course, we all know that when that happens multiple times at night, the fall risk really increases. So, a lot of times we will suggest, just for nighttime, let's put a bedside commode next to the bed so that you don't have to make that quick trip. And maybe you're avoiding the incontinence episode altogether. What is your opinion, though, on if we're having incontinence episodes and if we're not sure what's happening overnight, maybe we wear some type of an undergarment, some type of a brief. But I think I would encourage people, if you get that urge, if you know that you're having the incontinence episode or you've got to go to the bathroom, go ahead and get up and use your bedside commode. But I guess my thing is balancing. Someone would say, well, I'm going to be getting up 6 times a night, so then we have this disruption in sleep. But then I'm concerned about them, if they've got the right incontinence product, it will keep them dry. But what is your view on that?
Remind me to talk about the bedroom setup if I forget it. So somebody remind me. But to answer your specific question, I tell people this: if you or your loved one is awake and knows they're getting the trigger to go to the bathroom, they should go.
Okay.
And then the place they should go is the safest place they can go to void with lowest fall risk possible. And that's where I get to my bedroom setup. So one of the things that can be really helpful is the bedside commode. Not everyone is open to those.
Right.
Yeah.
And they aren't 100% for everyone, because depending on someone's size and mobility, but especially size.
Right.
Some of our much taller people or larger people, the bedside commodes tend to come in one size fits all. And so you have to be very careful that that's a sturdy place for this body to land, to go to the bathroom, alongside a caregiver in the middle of the night helping them. If you've got 2 people, or, if you've got paid help, it's a different story. But if it's I'm picturing kind of husband, wife, or daughter with their mother or something like that. You just got to look at the physical size of the person who's involved, the loved one, and know you've got to get them to a safe place. It can be the bedside commode, but it may not always be. So get them to a safe place to void. One of the reasons I said bedroom setup is one of the risk for falling is people who are sleeping opposite where their access to their bathroom is. So if you're sleeping here, but you have to go around the bed to go to the bathroom there, those people just cover more territory, and there's a dresser and a nightstand and the edge of the bed in their way. The people who are sleeping here going to the bathroom right there have an easier path to the bathroom. Now, I know it's like thermostat wars. Like where you're sleeping. I get it. And you can't, your caregiver undoubtedly has their own issues and challenges. So but just think about it. Just figure out what's the safest. And I've actually seen beds moved in a room in perhaps an atypical way from what we normally would have. But if, a bed move like this gives both people a little bit better, straight access is better than having to make a bunch of turns around obstacles.
Absolutely.
So just something else to think about. And then the other thing I wanted to mention about the safest route to the bathroom is for the fellas, there are the handheld urinals. And there are some interesting devices being created for women that are in the bed or bedside type options. And so I would encourage, thinking about that, because a fall for people who are frail can be one of the most devastating things that can happen to someone.
Yes.
So anything you can do to reduce fall risk is an overall benefit to that individual. And
Right.
so the adaptation sometimes of not leaving the bed and being able to void, again, we don't want, skin moisture. So if some of the handheld devices or a personal device for women can work, then for some people that may be the right solution. So hopefully people have people like you two to help steer them in the right direction and someone to give them some individualized guidance. But the thinking should be, how can we get our loved one to the safest place to void with the least likelihood of falling or having some trouble along the way?